Training Institute for Doctors in FATTAH-PUR, Azerbaijan. This paper is endovenous laser ablation of perforating veins in treatment of chronic venous ulcers in patients with diabetes mellitus. Thank you very much.
Thank you. Dear colleagues, my English is not good enough, therefore I apologize advance. I have honor of presenting our work on the research made in regard endovenous laser ablation of perforated veins in treatment of chronic venous ulcers in patients with diabetes mellitus. Venous insufficiency caused by the deficiency of perforated veins is one of the causes of chronic venous insufficiency of the lower limbs and development of chronic venous ulcers. The cost of treatment of this pathology is 1–2% of all expenses for the healthcare system in developed countries. The standard treatment of chronic venous leg ulcers is compression therapy, traditional surgery, and foam sclerotherapy. But at the same time, there are frequent recurrences reported. It should be noted that diabetes mellitus, in its turn, aggravates the course of disease and impacts the results of treatment of chronic venous leg ulcers. The aim of our study was to evaluate the efficiency of endovenous laser ablation of perforated veins in the treatment of chronic venous leg ulcers in patients with diabetes mellitus as an alternative to the traditional surgical treatment and compression therapy. This study was conducted on 42 patients with diabetes mellitus, 33 women and 9 men, suffering from chronic venous leg ulcers caused by perforated vein insufficiency. All patients were divided into 3 groups. The first group included 21 patients who underwent endovenous laser ablation by a direct laser with wavelengths of 1470 nanometers. The second group consisted of 10 patients who underwent epiphyseal ligation of perforated vein. The third group, consisting of 11 patients, received compression therapy with class 3 compression stockings until healing the ulcer. Post-operative wearing of class 2 compression stockings was recommended to all patients in first and second groups until healing the ulcers. In order to achieve expedient, satisfactory aesthetic results, a simultaneous mini-phlebectomy was performed in 5 and varicose foam sclerotherapy in 6 patients in the first group. The average age was 54.7 years. The average spread of ulcer area was 2 centimeters. The average diameter of the perforated vein measured 3.9 millimeters and the length to 3.4 centimeters. The average energy used in the ablation process was 340 joules. Term of data collection was from March 2016 to August 2018. On this slide, we can see the perforated vein with a diameter of 3.8 centimeters and reflux more than 0.5 seconds. This slide shows the whole cycle of procedures for patients with chronic venous leg ulcers. All mentioned above groups were under thorough physical observation, ultrasound examination of both lower limbs with the collection of analysis data. EVLA procedures start with puncture of perforated vein with a venous catheter, followed by input of laser fiber, installment of laser fiber into place of transition of infrafacial area, tumescent anesthesia with the clear solution, ablation with tract